Ever contemplated the importance of kneecap examination in autopsies? An unusual subject, yet it's incredibly captivating. Today, we're embarking on a journey to uncover this intriguing topic. Welcome to the enthralling intersection between anatomy and forensic science, a sphere where every tiny detail holds significance, where every finding is a clue that helps decode the enigma of life and death. The kneecap, known as the patella in medical jargon, is a minuscule yet powerful bone that unassumingly resides at the front of your knee. Often overlooked in daily life, it plays a crucial role in forensic pathology, requiring meticulous attention during post-mortem examinations, particularly in scenarios involving trauma or injury to the lower extremities. The kneecap steps into the limelight. But what is it about the kneecap that makes it so important? The answer is in the stories it can narrate. The kneecap and its surrounding tissues act as a storybook, ready to narrate the individual's past health episodes and the circumstances leading to their premature end. Pre-existing injuries are just the beginning. The kneecap can divulge information about chronic health issues that the individual might have faced. It can offer insights into medical histories, latent health conditions that were perhaps previously unknown or even forgotten by the deceased. Injuries like fractures or dislocations are easily identifiable during the examination of the kneecap. It can inform the pathologist if the injury was recent or old, caused by an accident, a fall, or possibly even act. The nature of the fracture or dislocation can hint at the applied force, the impact's direction, and the knee's position at the injury time. Furthermore, the kneecap serves as a protective barrier for the knee joint. It shields the intricate and essential structure underneath. Thus, the state of the kneecap could offer indicators about any harm to the joint, providing detailed data about arthritic changes, infections, or degeneration. The kneecap's dimensions, shape, and degree of wear and tear can shed light on the individual's age, occupation, and lifestyle. For instance, a worn-out kneecap might indicate a life spent in strenuous labor or engaging in extreme physical activity. Lastly, remember that the kneecap can also supply DNA, a crucial asset in forensic investigations, particularly in cases of unidentified corpses or identity disputes. So consider this. Isn't it intriguing how a tiny bone like the kneecap holds such enormous potential? Pre-existing injuries, underlying health issues, fractures, dislocations, all these can be exposed through a detailed examination of this small, yet remarkably significant bone. Imagine being in an autopsy room. This room stands solemn, cold, and sterile, an entity that appears removed from the rest of the world. It is a space of intense solemnity, bathed in harsh lights that reflect off rows of gleaming metallic tables. It's not a room for the weak of heart, but a field of unspeakable truths where life and death dance in an eerie ballet. In a corner, a collection of precision tools resides. They are meticulously arranged, each carrying a unique function. Among these tools, the scalpel holds a significant role. It is a device that, in the hands of the pathologist, becomes as accurate as a maestro's baton, able to unravel the mysteries veiled beneath the skin and muscle. This grim symphony follows a definite rhythm. Donned in protective gear, the pathologist is the maestro, guiding this macabre orchestra. The scalpel, the first instrument to be used, slices through the skin with surgical precision, revealing the intricate world inside. The room echoes with silence, punctuated only by the humming of overhead lights and the subdued rustling of the pathologist's movements. The air of the room is heavy, permeated by the sharp smell of formaldehyde, a scent that stays with you, a stark reminder of the finality and inevitability of death. The pathologist operates methodically, their focus unwavering from the body on the table. Their hands glide with a practiced elegance, their every action a blend of clinical detachment and silent respect for the deceased. Now, our gaze shifts to the subject of the autopsy, the knee. It's an astounding creation of human design, bearing our weight and enabling our movements. But within the confines of the autopsy room, the knee assumes a different role. It becomes an enigma to be deciphered. Each layer that is peeled back uncovers fresh clues. The pathologist's tools investigate and examine, gradually piecing together the hidden narrative. The knee narrates a story, a chronicle of a life lived. It exposes years of use, old injuries, and indicators of unnoticed diseases. Every mark, every deviation is a sentence in the biography of the individual on the table. The autopsy room functions as a theater of science, a stage for the play of life and death. It's a place of revelations, of comprehension. It's where we confront the enigma of our mortality, striving to make sense of the illogical, seeking order in the disarray. Despite the unsettling ambiance, there is an inherent beauty, a beauty derived from knowledge, from understanding the human body's intricate workings. It imparts a humbling experience, reminding us of our fragility, our fleeting existence. The first step is the knee. As the scalpel glides smoothly, it parts the skin, revealing the layers beneath. In the pathologist's hands, it transforms into a gateway, an entrance into the unseen world concealed within the human body.